was an awesome lecture. I think the two important messages for me were using like maybe cube sofa score, like scoring systems to see when the patient comes, hits the floor or in the ER. So who are the patients who are going to get sicker faster with sepsis? And I think the second message is probably the choice of fluids. What kind of fluids should we use to do the initial resuscitation? So I think the point is that we have to see what kind of a patient is it. Like if you have acute pancreatitis kind of a patient, we use like a Ringer's lactate in place of normal saline. So I think those are the two important messages I learned from this lecture today. And I think they are going to help me change my practice.
Well, sepsis is, a big driver in medical care right now. It's very expensive, and clearly what she showed is that we don't have a real good definition for it right now. We need to basically get something that's more evidence-based so we can know what we're treating. And I think from this lecture, what has been proven is that steroids help. And instead of us doing these additional tests to determine if somebody's adrenal insufficient, we just give them steroids.
Early treatment's the best, so you have to start with the antibiotics as soon as possible in the first hour, the fluid resuscitation. And I think that what I'm going to take away from this is really, it's because I'm a PGY1 resident, first year resident, so when I'm on night float and I have someone who's presenting with septic shock, act quickly and take control of the situation quickly.
Try to convince my colleagues, my critical care docs to not send the stem test, and then also broaden the antibiotics that I give to patients who I think have severe sepsis, septic shock.
There was a mentioning of a trial that talked about the differences between the use of different fluids in sepsis in patients with shock, and as well as just sepsis alone. And so I can already tell you that my view on LR over normal saline has changed, and I can anticipate using this particular fluid over normal saline.
So I think this certainly brushes up our knowledge and makes us aware about the latest guidelines, like the new Sepsis 3, new definitions, and how are the goals, are changing presently from the prior guidelines to the new guidelines. And luckily, I just became a part of sepsis committee at my hospital, so I was pretty excited to be a part of this lecture.